Hi, my name is Tamora. I'm a nurse working in the Reef Children's Cancer Centre at Monash Children's Hospital. I was part of the team that undertook a scheduling project for the Day Oncology Unit. This project was coordinated by PICS under the guidance of the Reef Oncology Leadership Team. The number of patients under the care of Monash Children's Cancer Centre has risen significantly in the last 2 to 3 years. With this rapid increase in patient numbers and increasing complexity of paediatric oncology treatment, the Children's Cancer Centre faced daily operational pressures to meet service demand. The project set out to understand Reef's workflow inefficiencies and process bottlenecks, explore the current staff sentiment and satisfactions, and gain insight into the patient and family experience when attending Reef. As part of the project scoping phase, time was spent consulting with key staff members to map out the current flow of the unit for all potential patient presentations to Reef. These included patients attending for a medical appointment and treatment, patients only attending for a medical appointment, and patients not requiring an appointment attending for treatment only. From this scoping phase, the key objectives set by the team were to improve the unit's workflow and, most importantly, improve the experience for all families and staff in their daily interactions within Reef. Strong themes were identified in all presentations when mapping out the patient presentations and gaining staff feedback. The strongest theme that arose was around the communication breakdown with patients attending Reef for a medical appointment and treatment on the same day. The solution was to create a consistent flow from the time of arrival for these patients and strengthen the team's communication. The project team collaborated with key stakeholders within Reef and Monash Health to understand all issues and identify and implement solutions. These solutions included the development of a structured calendar view for appointment and treatment bookings, working closely with the IT department to create separate calendars for all 12 treatment beds and individual medical appointment calendars. In conjunction with the new calendars, all treatments and procedures were assigned a time category and estimated duration that was indicated by its colour and time slot on the calendar. This allowed for improved planning in clinic, providing a visual overview of the day. An appointment booking guide was developed to support Reef's administrative staff. A structured and consistent clinic flow was agreed upon for an optimal patient experience when attending Reef. As part of the changes following a reduction in COVID-19 precautions, the service was able to design a clinic flow that once again utilised the waiting room space. Alongside the new structured clinic flow, a new communication tool was designed in consultation with key stakeholders to ensure a streamlined and consistent approach to communication. The tool contains instructions for discharge plans to be made by the ANUM and appointments to be made by administrative staff. A comprehensive standard operating procedure was developed to ensure the sustainability of the new processes post-implementation, with clearly defined roles and responsibilities for medical, nursing and administrative staff. The SOP can be used as a training tool for new staff and includes checklists for the patient arrival and discharge process. 4 months post the implementation of these service improvements, we conducted a survey to evaluate the impact and outcome of the changes. There was a lot of positive and constructive feedback from the multidisciplinary team within Reef. Staff feeling that the new calendars and treatment categories improved their capacity to plan their day and allowed for clinic to be staffed appropriately. As indicated here, prior to the changes, only 40% of staff felt that the old scheduling system met their needs, with this increasing to 70% post-implementation of the new scheduling system. From this evaluation survey, we were also able to identify areas for improvement and take on board feedback that would further improve the daily operations in Reef. We have had positive feedback to the team not only from staff but also from families acknowledging the noticeable change within the unit, specifically from a regional family who would normally endure the over 3-hour one-way drive for treatment. They reported to the nurse unit manager at the time that with their treatment days now being more predictable, they were able to utilise the Angel flight service and save themselves almost 7 hours of driving or a night at Ronald McDonald House. Overall, the new scheduling system has been well received by the team in Reef, with staff embracing the change and always striving for ways to improve the delivery of care to our patients and families. Thank you for listening.